If it wasn't for Mark Dwyer's incredibly persistent wife,
she was bugging me to, you need to do that again, you need to do that again.
A scan that led to a stunning surprise.
Got the call from my physician saying, well, got good news and bad news.
And one heck of a care team.
It was quite a journey to get there, though.
Mark would not be alive to tell his journey, which begins with some history.
My family, especially on my dad's side, has a horrible cardiac history.
So in February of 2024, at his wife's urging, Mark had a cardio score done at the University of Kansas Health System Olathe campus. The good news, his heart was great. The bad news, his primary care doctor, Mariah Andrews, said the scan showed a suspicious spot on his lung.
I've never touched a cigarette in my life, and I have lung cancer, potentially.
Obviously, he kind of was a little bit scared and shocked at first, not kind of knowing with that uncertainty going forward.
Dr. Andrews immediately referred Mark to the University of Kansas Cancer Center's Overland Park location for more scans. Then Mark was told he needed a special type of bronchoscopy not available everywhere.
It was so far down into my lung that a normal bronchoscope can't reach it.
Mark worried he would need to travel hundreds of miles from home for the procedure. It turns out he didn't even have to leave the health system.
We did a robotic-assisted bronchoscopy using our ion robot that allow us to diagnose him accurately and safely.
Interventional Pulmonologist Dr. Maykol Postigo works at the health system's KCK campus.
Actually, we are one of the leading organizations in the country.
And he got Mark in right away.
The fact that we were able to kind of get him plugged in so quickly, I think, is one of the strong suits of our health system.
Unfortunately, the results confirmed Mark did have lung cancer.
That's when the decision was made, okay, we need to do surgery, we need to go in and get this thing out.
And the surgery would also be specialized robotic surgery not offered everywhere.
I had other people telling me, you need to check out cancer centers and other places.
And Mark again thought he'd have to leave home for treatment until he talked with health system cardiothoracic surgeon Dr. Ashley Mann in Olathe.
And I said, no, we can do this here in town. And I think that was really important to him, to be able to stay close to home for his care, but to also know that his home had that kind of upper level care that he really wanted.
I told her on the phone, I was like, well, that's all I need to hear. You're my surgeon.
Dr. Mann performed a robotic-assisted lower left lobectomy.
She was amazing. She was confident in her skills, which makes us confident in her skills.
And just one day after surgery, Mark was home. 2 weeks later, he was back to work full-time and going to the gym. The entire 6-month journey.
It was all either in town, right where we lived, or literally just right down the street. My wife and I were just like, wow, you guys are awesome.
There was so much collaboration that needed to happen, from primary care to pulmonology to interventional pulmonology to thoracic surgery to oncology.
I think collaboration in medicine is more important than it has ever been. One person doesn't know everything. You can't be an expert in everything.
Just being able to deliver this kind of care to people, give them hope, let them know that they're in good hands, and that we will help you get through this, and we will help you get back to life. You should feel proud about that.